Welcome to K6 Wellness Revolution, where we believe health is worth fighting for. This podcast focuses on all things related to natural health, wellness, and vibrant living. We know your time is valuable, and I'm honored that you're spending some of it here. So get ready, because the Wellness Revolution starts right now. Welcome to the K6 Wellness Revolution podcast. I'm Sharon, traditional naturopath and family nurse practitioner at K6 Wellness Center here in Dallas, Texas, where we blend trusted expertise, compassionate care, and a passion for helping you achieve optimal health, because wellness isn't just a goal, it's a revolution. Now, this month, it's typically known as Breast Cancer Awareness Month, so you'll see pink everywhere. But at K6 Wellness Center, we like to turn from simply a focus on breast health to focusing more on, how we screen for breast health, but also expanding that into everything that screening can show us. And this screening is known as whole body thermography, and many people use it as an adjunct or as an alternative to mammography. And it's very useful for detecting not just breast issues, but also other health issues, and many times sooner than many typical diagnostic tests that already exist. So thermography is a non-invasive, radiation-free screening tool that provides very high-quality information. And it's about how your body's organs and glands thermoregulate. Today, we're going to be continuing our discussion of hormones from last month, and we're kind of really centering on how whole body thermography screenings can be beneficial for analyzing hormones at a deeper level to help you achieve optimal hormone health. So, many times in America, you're going to hear whole body thermography, and they may be talking about an infrared thermal imaging, or they're most of the time going to be talking about using an infrared sensor to take surface temperatures on many areas of the head and torso, including the breast. And this is also known as contact regulation thermometry. But these are often used in alternative medicine practices. And it's not singularly diagnostic, but it's a great way to get information using skin temperatures that are acquired in a very rapid succession, and it's very safe and comfortable for the patients. And one of the benefits of this type of testing is that it gives us the potential for early detection. Whole body thermography aims to detect functional imbalances or early signs of health issues by analyzing temperature variations, usually before there are symptoms being manifested in a person's health. And it also measures temperature at multiple points. Many times these points are correlated with acupuncture or reflexology points, and it gives a broad overview of organ or system function. And these temperature changes or thermoregulation changes can support a diagnosis, but it's not going to provide that diagnosis. But it's useful information. And as you know, when you're working on getting a diagnosis for something, it's not one thing. You're taking a clinical intake, you're taking a health history, you're doing a physical exam, you're doing labs. And in alternative health or in functional medicine, it's the same thing. We care about your health history. We care about what has happened. What are your experiences? What are your exposures to specific organs, to your breasts? What have your surgeries been? There are a lot of things that go into this. And then using thermography many times shows us where your body's not dealing well with, be it scars or surgeries or the removal of organs or previous infections or exposures to chemicals or toxins. So there's a lot of insight that is gained by using whole body thermography. But in addition to that, whole body thermography gives us, very personalized treatment guidance. So the results can help us to tailor treatments, because you can have 6 people with what looks to be the same result, but they got there 6 different ways. So that's why knowing your health history, knowing what has happened in your past, what medications you're on, what supplements you're on, what kind of diet you have, what are your lifestyle habits, all of these things are going to play a role in helping us to understand where you're at versus where you need to be. And we consider all of these things when we're looking at your thermal patterns and where we're going to, try to make changes in your paradigm. So also we use the thermography to monitor progress. It helps us to track changes in temperature patterns over time. And we're going to look at some of this today. For those of you who are watching on YouTube or Rumble, this can help us assess the effectiveness of interventions. So specifically though today, like last month, we talked about, maintaining your mojo and how you stay vibrant, and hormones are a big part of that. But in the context of hormone health, whole body thermography can be used to detect and monitor hormone imbalances such as estrogen dominance, which can manifest as an irregular heat pattern due to inflammation, or vascular changes within the body. And thermography can help identify how hormonal fluctuations can affect tissues, particularly in estrogen sensitive areas like the breasts, the thyroid, and reproductive organs. And that makes it really valuable for tracking the physiological effects of hormones on the body. So often as a complementary tool alongside blood tests or urine hormone panels or salivary hormone tests. And this is really beneficial for women who are going through fertility treatment or hormone replacement therapy through their perimenopausal or menopausal years. And even men out there who are going through hormone replacement therapy for testosterone. This can be very helpful. So with thermography, especially as it relates to detecting estrogen dominance, it can reveal lymphatic congestion or inflammatory hotspots linked to excess estrogen, which is common in conditions like fibrocystic breast changes or women who suffer from premenstrual syndrome. Chronic elevation of cortisol from stress, maybe it's burning the candle at both ends, working too many hours or going through a stressful season of life for a short period of time. These things can cause widespread inflammation throughout the body. This can be visible as, asymmetric heat patterns across the body. And that's in thermal imaging and in the infrared heat sensors taking temperatures. So these are all very valuable ways that without diagnosing something, but listening to a person's health history, we're able to look at a thermography and see the evidence of hormonal changes or imbalances playing out in a person's health. Thermography can help to track changes in tissue responses during hormone replacement therapy, which can help the practitioner to adjust treatments for menopausal or postmenopausal women, especially with regard to breasts and reproductive organs. So evaluating overall endocrine function, thermography can help to highlight thyroid related temperature irregularities, and adrenal imbalances. And these are going to affect energy, metabolism, therefore weight. Pancreatic function is going to come into play. All of these things are going to play together, and we often see overlapping irregularities. But we promote and use thermography particularly for preventive care. So where it's going to support personalized wellness plans, that's what we want to do. But thermography helps us to visualize how hormones influence inflammation and circulation, both vascular circulation and lymphatic circulation. So whole body thermography for hormone health most commonly gets used in women, especially women at risk of experiencing hormone related issues. Many times we have women come in because breast cancer runs in their family. And October is definitely the month that becomes more in your face, because everybody hears about breast cancer awareness. But we always I think we're always afraid of estrogen as women, and we don't need to necessarily be afraid of estrogen. It's a part of who we are. It's a part of what makes us women and what makes us feminine. But understanding estrogen's role in our health is very important. And I think that thermography is a great tool to help us understand that and to help visualize how estrogen can play a role in balanced health. But as far as, estrogen and hormone balance goes, when you look at women aged 20 to 40, we often see women coming in to get thermography for early detection of hormone-driven changes in breast tissue. Many times it's women with dense breast tissue, PMS, or early perimenopausal symptoms. And I think this is definitely something, women with fibrocystic breasts, they're also told, when they go to get mammograms, oh, you've got this spot, or you have dense breasts, and we need to do another scan and another scan and another scan. And before long, you've had all this radiation exposure only to find out, well, you have fibrocystic breasts. Okay, well, now how much radiation exposure have you had? And all of that radiation is not harmless. And I think it's really important, to have alternatives. And it's not that, all mammograms are evil. That's not what I want you to hear me say. But I think that we can do better. And I think that there is a role for infrared sensors using whole body thermography to help detect heat or, cold spots. Sometimes it's a cold spot that can show us where there's a problem in an area. But women who know they have dense breast tissue really do like having the thermography, because instead of having their breasts squished or traumatized, they're having a sensor literally just placed on the breast for a second, and it's like being touched. There's no more pressure than maybe a nickel. If I were to lay a nickel on you, that's about how much pressure we're applying to the surface of the body. It's just so simple and so without trauma. So that's a really nice aspect of thermography, especially as it relates to fibrocystic breasts. Perimenopausal and menopausal women do like to use thermography to help track estrogen fluctuations, such as hot flashes, how efficacious is their hormone replacement therapy. The thermography can really help identify inflammation from declining hormones or a lack of robust thermoregulation from having the amount of hormones that you had in your reproductive years. It is useful. Thermography can be very useful for postmenopausal screening, for disease prevention, for looking at vitality. There are established ranges that we like to see people's temperatures fall within, and we know these to be very healthy ranges for good health. And if we see temperature ranges exceeding that by a lot, then we know, okay, maybe we've hit critical mass here and we need to be looking at some of these real extreme areas. Or if we have people whose temperatures just don't change, maybe the thing is with thermography, everything's meant to warm up or cool off. And everybody hears hot spots, but really your head is supposed to warm up. Everything in your head should heat up, save for your maxillary sinuses. Those are the only points on your face that should cool off. But everything else should heat up just a little bit. So when you see red or something warm on the head in a thermography, it shouldn't scare people. But understanding and working with a practitioner who has a good understanding of thermoregulation in the body and what the autonomic nervous system is designed to do can really help you get a better grasp of optimal health and what's supposed to happen versus what is happening right now. Where are you at? Women on hormone replacement therapy. Using thermography can really help to monitor tissue responses to therapy, helping to detect imbalances like excess estrogen. When we get ovaries that are really warm or ovaries that are acting in a manner that is strange to the surrounding tissue or the correlating breast, we have to take a look. Using thermography to monitor hormone replacement therapy can help prevent, side effects from using too much or too little hormone. You want to avoid vascular issues. So with the thermography, being able to track lymphatic circulation. And I've always maintained this is one of the most beautiful aspects of whole body thermography is being able to really track lymphatic circulation. And there's nothing really in Western medicine that we use to track lymphatic circulation other than looking at a person and pushing on an extremity to see, do they have pitting edema? And we have a scale that we will use to measure that. But before that, short of biopsying lymph nodes, we don't do a whole lot for the lymphatic system. Fortunately, we have whole body thermography, which does look at the lymphatic system, and we are able to help make determinations about how well circulation is happening. Is there inflammation or hyperregulation within the lymphatic system, suggesting maybe a hormone excess, right? Or maybe there is so much inflammation that there's congestion because there's compression on lymphatic vessels. And this, again, can be very nuanced, and it does require a practitioner with knowledge and experience and an understanding of the lymphatic system to be able to look at a person and determine, based on health history and clinical presentation and other tests, experiences and exposures, what's going on, and how do we address this lymphatic system? Because your lymphatic system is so intricately tied to the immune system. You really can't separate those, and you don't want to just ignore the lymphatic system. It's so important, especially women with, and men for this matter, with women with chronic stress or inflammation. Everybody has so much stress. And I feel like this is something we see all the time when we're doing cortisol tests with people. High cortisol is so common. And when you have high cortisol, remember, cortisol is your hormone that helps manage stress. Cortisol's impact on your whole body hormone balance can be pretty significant. When you have high cortisol, it is going to cause a lot of things to happen and can make it very difficult to lose weight. It is going to influence how your thyroid works. Then that in turn is going to influence sex hormones. It's going to influence glucose regulation. So it's really important to get a good look, not just at one thing. And cortisol, so many times we have people come in with blood tests on cortisol that were taken at 2:30 in the afternoon after lunch. It's useless. It means nothing. Blood tests for cortisol have to be done in a very specific manner in order to be useful. It's more useful to understand what happens to your cortisol throughout the day and the evening, because our cortisol is different throughout the day. Our cortisol starts high and it decreases as the day goes on. And it has an inverse relationship with melatonin. And how many people are taking melatonin to go to bed at night, and maybe they're spiking cortisol, late in the day. Sometimes, these blood tests are just not helpful because they're not giving an accurate picture of everything that's happening. So using thermography to get a look at, okay, what's going on with adrenals, what's going on with lymphatics, what does the thyroid look like? And we're going to look at some of this and what can happen over time to take some of these tissues and glands from a very inflamed or non-constructive thermoregulation to a very healthy regulation. And it does take time. But having chronic stress and inflammation and how that can show up in a thermography, it helps the practitioner to understand, okay, we're going to support this person with this type of intervention, be it a supplement, a lifestyle intervention, or a dietary modification, or maybe it's a medication. Even pregnant and breastfeeding women can do thermographies. This is really helpful when lactating women, especially, have a tendency to develop mastitis or lactation issues. We can detect those with very hot and blocked patterns of thermoregulation within the breast tissue. And it's really nice to be able to do that without using compressive methods or having to use radiation on the breast tissue. And there are so many different ways that we're able to adequately address breast health for lactating women in a way that is helpful and healthful for mom and baby. So that's really cool too. It's important to understand that, when we're detecting excess estrogen, it's important. The reason we want to do it is because it does often lead to inflammation. It does often lead to increased vascular activity in certain tissues, like the breasts or the ovaries or the pelvic region. And when we pick that up in a thermography, it's usually way before there's any diagnosis. Usually when women come in, they don't have a diagnosis in their lymphatic area, or they don't have knowledge of a pelvic issue. Sometimes they do, but not often. When we're able to say, hey, we know you came in here to lose weight, but we're seeing this endocrine issue. Let's go ahead and do a little more investigative work into your hormones. That helps. It's really nice to be able to really highlight one area rather than saying, okay, we've got to focus on toxins now. And we do concentrate a lot on toxins, and thermography is really helpful for highlighting, oh my goodness, look at this person's, head points or whatever. There is a way that toxins show up. But just as that is a signature, as we call it in thermography, there is also a way that hormone imbalances show up. And so when we're able to identify that and isolate that, it's really nice when we can prioritize, because you can easily spend $5,000 to $8,000 in testing just to know all the things that are wrong with you before you spend $1 feeling better. Because there's no therapeutic value in testing, remember. That's just the investigative part. And we can guess. Guessing's free. But that's not what we're here to do. We're not here to test for people. We're really here to help people feel better. And I think that's one of the really good things. There's so many ways that the body can show us where you have, certain tissues, or it's like, yep, this organ is definitely a problem, or a toxin is the issue, or a heavy metal may be the problem, or your thyroid's junked up. We gotta fix it, or you're not in the sweet spot with your prescription. It's really nice to be able to see that. So with breast tissue changes, excess estrogen can cause angiogenesis, which is new blood vessel formation, or fibrocystic changes. And some women don't even know they have fibrocystic breasts. But they go get a mammogram for the first time, and they're told, you have to come back. We saw something. Well, what's the first thing that goes through a woman's mind? Oh no, I have breast cancer. Well, now you have a lot of fear that just got added into this very traumatic medical test. None of it's constructive. None of it's helpful. And it's a big, I don't know. So being able to start with something less invasive, no, it's not diagnostic, but mammography is not completely diagnostic either, because they're not really going to make diagnoses solely based on one test. There's always going to be something else done next. And that is something, even with thermography, if we see something suspect, we don't just stop. We don't guess. You may need to go have a breast ultrasound done. And some women do need to go have a diagnostic mammogram done. But we want to help women make the best decision for their health that they possibly can. So that's a really cool aspect of using thermography when we're just looking at breast tissue changes. And really, even women that have had like breast implants removed or put in. Most women who have breast implants do not want you flattening their breast tissue in a mammogram, because there are a lot of implant ruptures that have happened because of mammograms. for a woman to have breast implants done takes a lot of mental and emotional energy to make that decision. It's a big financial investment and it needs to be cared for. There are a lot of health implications to breast implants and explants, and thermography can play a big role in helping to mitigate some of the more hazardous features of breast implants and some of the autoimmune dangers that have been made known to us through the last several years with all of the breast implant illness lawsuits and warnings that have been required to be made on some of these breast implants, because silicone, though it's inert, can still cause autoimmune problems. The body will encapsulate things that it doesn't want to affect you, and these breast implants can grow mold. And we have many women with scarring issues from implants and explants, and there's a lot that can continue to influence a woman's health. And so thermography really helps to steer us in the right direction with how to help a woman, whether it's through scar therapy or lymphatic therapy, or is there maybe still something hanging out in the breast tissue that needs to be looked at by a surgeon. So that's something that we're able to help women with. So, yeah. There's also, there's other systemic effects because, or relate not to breast tissue, but sorry, back to estrogen. Estrogen imbalances will also influence thyroid function or adrenal activity. And that can lead to really widespread temperature irregularities. For instance, having really high estrogen states can cause much warmer thermal or much warmer temperatures in the neck. So in the thyroid and the lymph temperatures that we take in the neck, that can show up. Or even in the ovaries and the lower abdominal areas, they can show up much warmer when there's higher estrogen levels. And we look at it as, hey, there's going to be some hormonal stress here. We need to look a little closer at what the body is doing with estrogen. And then there's a whole cascade from there that we would look at. Thermography can also establish kind of a baseline thermal map of the body. So when we have somebody come in the first time we see them, we always like to get a thermography on all of our new clients. Now, not everybody does a thermography the first time they come to K6 Wellness Center. We wish that they would, but not everybody does, and we don't make you, but we wish that you would. So if you haven't, you should. It's a good baseline. So if you want to know how am I doing now versus how was I last year or 3 years ago, a thermography is a great way to know. So changes in the thermal patterns over time, especially if you've had hormone therapy or you've shifted your diet or lifestyle, maybe you've now become a biohacker, or you've had surgery and you've had, something removed. Using thermography can help show you, hey, this has gotten better or this has gotten worse. And sometimes it can even show you where hormones are improved, hormone balance is improving or not improving. For example, a reduction in, quote unquote, hot spots after starting hormone replacement therapy could indicate better hormone balance. And I'm going to show some thyroid improvements here in a little bit. But I want to talk a little bit about breast heat patterns. So I want to show you how a breast tissue can show up, how it would show up ideally versus how in reality we might see it. So I've got this little visual here, and on a graph that we would look at, you can see these blue lines where we would see first the right breast and then the left breast, and they're identical or symmetrical. Now, if you're listening to this podcast, this would be the point in the show where you might want to switch over to YouTube or Rumble so you can see this. If not, whoops, you would just have to take my word for it. Now, the breasts, the way that we measure them is we start on the upper outer corner and we go around the breast and then we do the areola. So we do the same thing to both breasts. Now, if you look at this bottom, you can see, okay, that doesn't look anything like the top graph, but this right breast, it at least cooled off. All these blue lines are indicating a cooling pattern. But then we got over to this left breast, and lo and behold, well, red means it heated up, and then the yellow is telling us absolutely nothing happened there. It was like a dead spot. It was blocked regulation. So we have, and it's pretty warm there too. So we had hot spots here, and then it was a little bit jumbled or chaotic. So when we have uneven heat between breasts or intense, localized hot spots, this could be suggestive of an estrogen driven issue, like a cyst or a growth or some sort of increased vascularity. And this is something that we would definitely want to look at very closely. And since I'm on the screen, one of the things that we really like for people to understand is the dental relationship to breast health. And this is the dental chart. I love this chart. Whoever Dr. Elmira Gadol is in New York, you can look this up online. There it is. But you can see that in the right upper quadrant and the left upper quadrant, and then each lower quadrant, basically you've got 5 teeth in each quadrant or each half of the mouth that correlate to one of your breasts. Well, in Germany, they have the statistic, and they say that 95% of women who have breast cancer have a root canal on one of the breasts associated with that tooth. Or, yeah. No, they have a root canal on one of the teeth associated with that breast. I knew that didn't come out right. So that's pretty staggering. That's a big statistic. But you see here, these are basically your molars, right? And then you've got lung and large intestine teeth. You've got stomach and pancreas teeth. And then left side, same thing. So it's important to understand, well, if I have metal on these teeth and those teeth could show up problematic. These are the teeth. Teeth should heat up and they should be this is the upper jaw and this is the lower jaw. And the teeth should show up very symmetrical. And then here's what we typically see. Something not quite as ideal as the pretty picture, right? But there are a lot of things that play into that. Did this person wear braces? Does this person clench their teeth? Do they have dental work done? Do they have root canals? And this person's teeth actually aren't that bad in the grand scheme of things. But these are all really important aspects to understand when we're looking at a person's whole body health. And if we're looking at a breast heat pattern, we want to know, are there other correlating tissues that back up what we see in the breast tissue? Because really, no matter what you're looking at in the body, there's going to be something else that kind of indicates the same thing. Excess estrogen can, like I said earlier, impair your lymphatic drainage, and that can also look really warm in the breast area and the underarm area. So it can also cause, warmth in other areas, even especially in the lower abdomen. Women who have PCOS tend to be, or polycystic ovarian syndrome tend to be estrogen dominant. That's a big problem, and we'll see, many issues from that. Hot spots in the lower abdomen could also include women, dealing with endometriosis. It could show up on the intestinal points, and the bladder and the uterus. So these are all areas that we need to pay special attention to. Now, let's talk about the thyroid. So estrogen is not our only hormone, of course. Thyroid is really important in whole body thermography. It is something that we pay a lot of attention to because we do see a lot of problems with thyroid in America. There are a lot of theories as to why that happens. And I think it's a really interesting conversation all by itself. But in the scheme of today's conversation, just looking at, hormones, with regard to breast health, with regard to reproductive health, which is really kind of where we're pointing. Thyroid's upstream of our sex hormones. And, people who are going through fertility treatment, one of the first things they're going to get checked is their thyroid. Because if your thyroid doesn't work, chances are you're not going to have an easy time conceiving. So the thyroid in whole body thermography should warm up. So when we have the person in thermography, we take baseline temperatures. We have you stand for 10 minutes and rest. You're not resting. You're usually stressed out because you have to strip down to your undies and stand for 10 minutes, and you can't shiver and you can't curl up in on yourself and you can't sit down. You just kind of have to stand there, and it gives your nervous system just time enough to adapt to the fact that you're standing in your undies in a strange room and it's kind of cold. And then we come back in and we take your temperatures again. And with regard to your thyroid, it is the only place other than your head and the whole body that should heat up. And if you think about it, your thyroid's pretty important. It's the master of your metabolism. It has a lot of work to do. It has a lot of heat to generate. So on thermography, it cools down. It's a good indication that your thyroid is not optimized. And what that tells us as the practitioners looking at the thermography is that, we've got to do some labs. We would never diagnose hypothyroid based on a thermography because there can be many reasons your thyroid is not heating up. Maybe it's too much iodine. Maybe it is not enough iodine. Maybe, there are other things at play. There could be some goitrous issues going on. And this is where a physical exam is important to do a health history, family history, because thyroid issues often run through families. But it's also important to know what medications and supplements a person is on. So, for us especially, most people who come in already take thyroid medication. And I cannot tell you how many times their thyroids still cool off in their thermography. And it's unfortunate that happens. It just tells me, well, we haven't hit your sweet spot yet with your thyroid function. Doesn't always mean that their prescription is wrong. But when you look at your thyroid metabolism, there are a lot of nutrients that are important to that. And sometimes you could be deficient in one of the cofactors that's important along that pathway. Or maybe there's inflammation in the thyroid. Maybe your immune system has decided thyroid's a foreign body and just doesn't need to be there. These can show up in different ways. And so that's important to understand as well. And if we can help, direct testing to better diagnostics, that is going to give a better outcome to a person with thyroid problems. And so let's actually look at that real quick. This is something that we do see a lot with people who come in for the first time. Now, what I'm showing you is the whole head and neckline, but what I want you to see is right here where I have highlighted. Now, blue on this graph means cooling off. So thyroid, as you remember me saying, should heat up. So this is the right lobe of the thyroid, and this is the left lobe, and these should both be red. And this person in December of 2022 was cooling off. Now there's an added problem here. This person's thyroid temperatures dropped below this baseline that you see here. When the thyroid temperatures drop below baseline, as a practitioner, I automatically go, I think there might be a chance of autoimmune issues going on, because that's something that we don't just see with regular thyroids. So we start to address this person's thyroid. So in the next summer, August of 2023, we see yellow and it's above baseline. Well, we went from cooling off to now it's not moving at all, which is a little closer to warming up, but we're not there yet. But we did warm up the overall thermoregulation. So this was gentle improvement, but we weren't there yet. One more year went by, and look, we've got one lobe actually heating up and the other lobe is getting there. So this is just to demonstrate that it does take time, but change is possible. Now, there's a lot of other things that we could draw out of this thermography, but really I just wanted to highlight the thyroid part of this. There are a lot of things that do change, even, day to day, based on what a person is eating, how they slept, what day of the month it is for a woman. There are so many things that could play into, how a thermography shows up. And one of the beautiful things about thermography, especially the system that we use, is that we're able to apply a therapy such as chiropractic, acupuncture, neural therapy, and we can immediately see the therapeutic value. Did we achieve the desired result? Were we able to take this person from a very cold or a very hot range into a more therapeutic thermal range? So it's really kind of fun to do this. Thermography is very useful, helping us formulate, where do we go next? What, we think we have a handle on thyroid, now what? Because something's going to shift, right? Homeostasis is never a place where we just land and stay there, because the world around us is changing, so our body is always changing. Whether we need to order a hormone test or concentrate on toxins or focus on a gut issue, we can marry our long-range plans with immediate interventions based on what we see in thermographies. And even, doing lymphatic therapies for breast issues. If we think, look, this breast issue really smacks of lymphatic congestion, we're going to do weekly lymphatics and we're going to repeat this breast thermography. And if it hasn't changed, then we're moving to more imaging. Or if it did change, then yay, we know we've got lymphatic issues and we're going to really pursue that hard and heavy. We're able to help people understand their body better and pay more attention, be more engaged with themselves, and tune into their own, what their body is telling them. There's so many times people don't listen to their bodies. I think we're programmed to kind of tune out. We're so distracted. And so thermography helps us to tune in. Thermography is so sensitive to early physiological changes, detecting heat from increased blood flow or inflammation before the anatomical changes appear, like lymphedema. Your lymphatic system will tell us, months and years before lymphedema becomes a daily reality for you. Or even in the breast tissue, we'll see it a long time before an ultrasound or a mammogram might show, ooh, here's a hot spot. We've got a mass we have to worry about now. Now, the one of the limitations, though, like I've pointed out, is that thermography is non-specific. We can have 6 people show a hot spot for 6 different reasons. So it could be from an infection. It could be from an injury. It could be from some other kind of trauma. So it's not diagnostic all on its own. We do use other tests, blood tests, hormone tests, imaging such as ultrasounds, x-rays, and sometimes we need CTs and MRIs, mammograms. But we will do whatever is needed to confirm what is going on in an area so that we can apply the appropriate therapy. But this is why, thermography it's a good baseline. I always tell people it's the best physical you'll ever have because it gives us a good idea of what your autonomic nervous system thinks about how you're living life and how it's dealing with your daily stressors and what your experiences and exposures up to this point have cost you. So it's not a standalone diagnostic tool. And we always emphasize that we want to combine it with really good health history, with a really good physical exam, with really good labs, and imaging if needed to be as accurate as possible. So the FDA really only clears thermography as an adjunct for breast screening. It's not a primary method, so I do want to be clear about that. But if you're considering thermography, you do want to seek providers who are specializing in functional medicine, and especially, functional medicine with hormone focused care, because you want personalized advice. You do want somebody who understands how hormones are going to influence your autonomic nervous system response to stress, especially women in your perimenopausal and menopausal years. But that is, just, I think, skimming the surface, if we're being honest about what whole body thermography can offer you for hormone health, from your adrenals and thyroid to reproductive health, and even how all of that influences breast health. There's so much to be gained from a whole body thermography, because what shows up in one area of your body, I promise you, is going to be reflected somewhere else in your body. And this has been studied since the 1950s and cataloged. We have generations of data showing us how the body echoes time and again. This happens here, but it also shows up here and here and here. And it's the intelligent design of the body just showing us time and again to pay attention to areas that need a little TLC. Well, that's a wrap for our conversation today. We did miss Elena. She is busy on vacation, and we wish her well. Thank you for tuning in as we continue to share how thermography can be an incredible tool in all areas of your health and wellness journey. Don't forget to like and subscribe. If you're watching on YouTube, follow us on Rumble, Facebook, LinkedIn, and Instagram for more wellness content. And if you'd like to book a whole body thermography screening or a consultation with one of us, visit k6wellness.com to learn more or schedule a free discovery call. We are located in Dallas, Texas, but we work with people all over the world. Until next time, take care, be well, and as always, your health is worth fighting for.